Hi, everyone. Welcome to the Creating Care Economy Indicator at the Local Level panel in this edition of the UN World Data Forum. This is my first UN World Data Forum panel, so I'm really excited to be part of this great community with these amazing ladies today. My name is Mercedes de los Santos. I'm a project manager at Open Data Charter. We are a global organization working to promote 6 open data principles into public policies to ensure government collect, share, and use well-governed data to respond to pressing challenges that we have ahead. With me, there in presentially is Sheida Bari of Open Data Watch, and virtually is Dulce Collin from the government of Mexico City, and Marisa Miodowski of the government of Buenos Aires City. As the title of the panel suggests, this session is focused on strategies and experiences held by 2 local governments, Buenos Aires City government and Mexico City government, represented by Marisa and Dulce, and one from international perspective, Open Data Watch. The 3 speakers promote gender equality through open data around the world, so I'm really excited to learn and hear about your experience, ladies. First, to introduce the speakers, I would like to introduce the thematic of this panel, because last year, and especially the pandemic, has brought to light in an unprecedented way the importance of care work for sustainability of life and the unequal distribution of labor among men and women across household, public services, the private sector, and community organizations. Surveys conducted since the start of the pandemic have confirmed that women have suffered the greatest increases in caregiving. Also, government policies and programs require quality data to calculate possible care needs and intervention that reduce inequality gaps. From a policy view, it's clear that governments require new plans to deal with the care crisis. In this scenario, presenting an example of data policy that helps make problems visible and offer effective solutions of care supply and demand is an important step to closing gender gaps. For that, this panel will showcase 2 local experiences of Buenos Aires City government and Mexico City government, which are building care indicators to measure care needs, as well as the knowledge of Open Data Watch working on close gender gap by data. To begin with the panel and with our speakers, I would like to start the discussion with Sheida, who is presentially in the room, who will introduce us to the current state of open gender data around the world and what is important for care. She will discuss the broad data ecosystem in which open data on care tasks exists and the action needed to overcome the challenges that hold us back from making the most impact. Sheida Bari is the Managing Director of Open Data Watch, an NGO focused on monitoring and promoting open data in national statistical offices. She has been an active member of the UN Secretariat General's Advisory Group on Data Revolutions, co-chairs of the Sustainable Development Solution Networks, and has played a key role with the startup of the Global Partnership for Sustainable Development Data. As a senior advisor, Sheida works closely with the Data2.13 team, focused on knowledge creation and advocacy for closing gender data gaps. Sheida, could you tell us a bit more of your emergency findings and key promising actions to the open gender data, and how can open data be a key to drive gender pay equity in the care economy? Sheida, the floor is yours.
Thank you. Thanks, Mercedes, and thank you for organizing this important session. I think everybody in this hall should be in this room, because this is such an important area of how we can get to gender equality and how important the care economy is, because as we know from the data from OECD, there is women and girls are disproportionately affected by the burden that they have on the care economy, taking care of the elderly, taking care of the disabled, taking care of children. And the data actually shows that women spend 3 to 6 hours per week on, on care economy, whereas an unpaid care work, whereas men only maybe 30 minutes to 2 hours. So we see that this is a very important area that we need to pay attention for, just not for the gender equality, but really for building better economy and better societies. So, but this is an invisible area, invisible because we haven't had enough data, and we haven't had the data that we could actually make open and accessible. I have a set of slides, if you can put it up, and I'll drive through it. My slides. We are testing this is the first session of the forum, and it's a very complex hybrid session. So you're being very patient with us for getting everything so that, hey, it worked. Can you imagine? So I'm just going to be talking to you a little bit about the importance of open data, that even in sectors like the care economy, how can we, when we collect the data, how can we actually make the data more accessible? So first of all, I wanted to say that for the care economy, internationally, this has been very well paid attention to. It's a subject that is very prominent and shows and is really enshrined in the Sustainable Development Goals. Here I've picked a few of the indicators that are directly measuring the care economy. As you see, the gender equality indicator 5, and then the gender equality goal 8, goal 5 and goal 8 on decent work and economic growth. They both pay attention to this subject, and there are a number of indicators. We have the indicator target 5.4, and then we have a target 8.51 and 8.52, which are lots of indicators that give us the data that we need for measuring and understanding the care economy. The source of this data are really difficult to get to. You have to have labor force surveys, you have to have time use surveys, your countries have to have the capacity to be able to produce it. So the point that I'm making is that once we have this data, it's really precious. It's so important that this data gets released and get made open and accessible. And we want to find out, the rest of my presentation is how do we stand on the open data. And this is a slide basically showing you that even though the countries are committed to having this data, but how are we doing in terms of countries' performance on open data and making the data accessible. But before going there, I just wanted to share with you what the definition we have on open data. Some of you in the room are open data experts. My colleagues know that open data means basically you have to have open license, you have to provide access, you have to make the data in machine-readable format so people can download it, and the data has to be in non-proprietary format, so you don't have to be worried about whether you're violating any rules by downloading it and using it. What we look at is to sort of see whether the data is available and then the data is open. And one of the reasons we make such a big fuss about this availability and openness is based on, sorry, I have to go back. And openness is based on the data value chain. The data value chain basically shows us that we really need to nurture the data from the production all the way to when we use it and when we have impact, when we link it to policy. Then an openness for us, the data openness is where do you see the crack, that if you don't have the openness when the data is logical, when the data is locked up and it's not accessible, it wouldn't get to the other side of the data value chain, meaning that it would be a waste, it would break this value cycle. And also, a lot of this data, as I said, is expensive to produce, so you have to use it. So you're just building the barriers if you don't have open data. And many of this data also needs citizen engagement. it needs trust in data systems. So if you don't make the data available and accessible, you also damage that kind of trust and that, that need from citizens to be engaged with data. We call that data agency. That people should really see themselves. So if somebody fills out a time use survey, if somebody reports on their household work and so on, and they don't see any impact, they don't see that data available, next time, we are all human. You don't really have any incentives for providing that data, and you don't trust the system. So it's very important. I make a big fuss. I hope that stays with you, that really that stage of the data value chain is tremendously important. So where do we stand on the open data? My group, as some of you know, we produce every other year. We survey the countries, and we produce an index which is on openness and data availability. We call that Open Data Inventory. Name is ODIN. And what ODIN, the latest one that has come out based on 2022-2023 data, shows that we still are, in many parts of the world, not there. So what we want is like this dark green that you only see in a few spots in the world. But more and more we see countries that are moving towards that. And I hope, as we say, in future we will even see more countries in dark green. But let me focus now on gender data coverage and tell you a little bit more about that. From the whole set of indicators that we select to measure the availability and openness, we also do a deep dive on those indicators that are specific to gender. Some 20 indicators in 8 different categories. And one of the things we observed, and I don't know whether this was obvious to you, it was not obvious to me, and I've always been surprised over the years that we see this persistent pattern that the data, which is non-gender data, actually is more open and more available than gender data. So for example, macroeconomic data, financial data, other categories of data, and it's really surprising. When you look deeper, you see, because those data areas, maybe the demand is higher for them. Maybe it's because there's more investment from the countries to pay attention to its openness and availability. But again, another message to walk away with is that while we're working on improving data gaps in gender data, we should also watch out for how we make it available and open and make sure that this doesn't get locked up. So, for looking to the future on how we can actually do better with, or have a path towards open data for gender equality, just a few suggestions from my side. Of course, I'm very much, as you see on the left-hand side, I'm very much into monitoring. Monitoring where we are, I think, has been very important. We've seen, and of course we appreciate comments from you, we've seen that groups like mine who actually monitor where the state of data is in countries, we've been very motivated, and countries are telling us that this is the right thing to do. We need somebody to look to see how we compare with each other, where things are, and who are the champions, and who are the ones who are kind of falling behind. The second thing is that we really need to advocate for more gender data and also for more transparency of data, but also transparency of regulations and policies. Many of these regulations and not only the data, but also what are some of the impact of this data is not being really obvious, and we need to be doing much more advocacy. The third thing is that we've seen that public and private partnership, and also the public in terms of citizen partnership with governments has been very important for supporting gender sector and many sectors, but specifically gender sector. In the World Data Forum, you're going to see a lot of sessions on citizen-generated data. When you go to those sessions, think of care economy. It really applies that care economy can really benefit from citizen engagements and citizen data, but also from private sector data. Many of the private sectors collect amazing amount of information that we could really benefit from for measuring the care economy and gender equality. And finally, we need to document and communicate cases that have been, that data has been used and has had a positive impact, and really show the value of openness. We have seen some of our colleagues who have shown data, for example, for improving transparency, improving corruption, improving different elements of different sectors. So it's very important for us to keep an eye on what is working and actually bring those stories out. My final slide is that many countries feel like they are stuck in a vicious cycle. The vicious cycle where we have low capacity that gives you basically low level of data and low level of usage, which in fact make the budget and resources available to countries less. So I call that vicious cycle. And one of the theories that I've been working on for years, and I see that it's working in many countries, is that when you make the data available and accessible and open, that's one of the elements that could really turn your vicious cycle into what we call a virtuous cycle, which is building a strong system that when you have data that's used and has had more positive impact, so it gets much more attention by policy makers and decision makers and resource increase. So it could create a virtuous cycle. And this is what we want for gender equality, gender data, and particularly for care economy, is to turn things into a virtuous cycle for the future. So that's all I have, and I'd be happy to answer any question. But again, I want to stress the importance of the care economy data, but also the importance of not only worrying about creating better data, but also making our data more accessible and more open. And thank you very much. Over to you, Nasir.
Great. Thank you very much, Sheida, for your presentation and for all the recommendations that you share with us for the future. And I think that one of the things you mentioned before, it's very important because we need to share and to communicate the benefit of published gender data, because it's that help to promote and to use government data to improve the public policies. For that, I would like to continue that conversation with Marisa Miodowski. She is a gender policy specialist from Argentina. She studied political science at the University of Buenos Aires and has a master's degree in sustainable international development from the Heller School for Social Policy in the United States. Since 2016, she works in the government of the city of Buenos Aires, where she coordinated the city's gender equality strategy. And in 2021, she joined the Buenos Aires Statistics Office, where she has coordinated several data production projects, including the care indicator system. At the beginning of 2022, the government of City of Buenos Aires launched the care indicator system that I think it's a really interesting initiative to learn more from. And it's an example that Sheida mentioned before, when the government can share with the community the benefit of open data and the benefit of open data trying to close in a gender gap. So Marisa, could you share with us the work that Buenos Aires City is leading to promote gender equality through data, and how you envision this caring indicator system in helping you out with that? Marisa, the floor is yours.
Well, thank you very much, Mercedes. Thank you very much for the Open Data Charter for organizing this panel and for inviting me to share our experience with such a prestigious other speakers and with the audience. I would like to react on what Sheida just mentioned and to try to show you how her theory or her advocacy for open data and productive data and the co-construction of data with civil society actors and the private sector could be possible by telling the experience of us in the city of Buenos Aires. But for the audience to understand better about what I'm going to talk about, if you could kindly share, Mercedes, before sharing the presentation, just a snapshot of the care indicator system of the web page, so people can understand a little bit about what I'm going to talk about. If that is
yes,
possible.
yes, it's possible, but the organizer should stop the presentation because I cannot share my screen now.
Well, that doesn't matter. I can tell the story. But basically, for you to understand, we built a web portal with some 70 indicators that are organized around the conceptual framework. This conceptual framework refers to care, and the definition is in your screen, and refers to the tasks that satisfy physical and affective needs that allow the reproductions of people's lives. So it's a very comprehensive definition of care. And we organize the information around different axes. On the one hand, if you can move to the next slide, please, on the actors that provide the care, and we identified 4 main actors: the government, the community, households, and the private sector, and on the other hand, the people who are receiving the care. And for that, we identified 3 main populations: the elderly, young people and adolescents, children and adolescents, sorry, and people with disabilities.
Sorry, Marisa, we are still seeing the conceptual framework slide. Please, can you share the next slide, please?
It doesn't matter. Like I'm going to tell you the story, and you can, so we can use the time for questions and for people to raise other points, because I think that we have a good story, but with a lot of room for improvement. So we really will appreciate your feedback after my presentation and after you have the chance to have a look at the web portal. So basically, in this slide is what I mentioned about how we organize the information. We can go to the next one, please. And here are the operational definitions, because we have to organize the data that we have into very specific categories that could later allow us to analyze how care is organized in the city of Buenos Aires. We can go to the next one. And to the next one. So we organize all this information along 2 main variables that will allow us to understand the inequality in the distribution of care. On the one hand, most of our indicators are disaggregated by sex, and this allows us to understand the gender distribution of care responsibilities. That, as Shaida was mentioning in her presentation, is very unequal, and it represents a much and high burden for women than for men. And also, we have another very significant variable in organizing our data, that is geographic location. And in the case of the city of Buenos Aires, there is a high correlation between where households are located, where the population live, and the economic situation. And it happens to be that in the southern part of the city, there are more households living under more difficult economic situation. There is a higher poverty rates there, and the opposite happens in the center and in the northern part. So this distribution of where people live, of the geographical distribution, allows us to see where the needs are and where the services are located. If you can go to the next one. So in order to create the indicators, we used different sources of information. as we, the Statistics Bureau, are a data producer organization. We use most of the surveys and censuses that we produce that had some information related to care. Firstly, the annual household survey, where we have information about the economic activity that households and people do in the city of Buenos Aires, and there we have a category that allows us to understand who of them are involved in the care sector. Also, with that survey, we have an idea of how the population is distributed and how old they are. All the demographic statistics are coming from that survey. We also have a chapter that deals with disabilities, and from there we calculated the demand of care for that population. The time use survey, that in the city we are lucky enough to have several rounds. We have two, and another one that is going to take place this year. We have also the population projections coming from the national census that allows us to understand what is going to look like, how the demand of care is going to look like in the future. And on the other hand, we have a lot of administrative records. And this is very important because, as Shaira mentioned, producing data is very expensive. But sometimes when we have data that is produced by the government, by the services that we are offering, the production of these indicators is much cheaper, and also it could be more rigorous because it will allow us to update this information on a more permanent basis. So we use many of the administrative records to combine that data with the survey and censuses, and to have a better panorama of how care is distributed in the city. Can we go to the next one, please? This is a screenshot of how the web portal looks like for you to see. In the right side, you can see all the indicators. If you click on them, you will allow to see the gender distribution that I mentioned before, and also the geographical distribution. And in most of the cases, the indicators allow for a graphic representation that makes the data more accessible, more friendly for non-specialized audiences. But here in the next slide comes what I think is the most important part of my presentation, and has to do with the process on how we build the system, and the role that several actors have in order to produce something that is usable not only for the government but also for other actors. If we can move to the next one so people can follow what I'm saying. And basically, I would like to emphasize the value added of the international cooperation. We were able to build this beautiful project thanks to the effort and the energy of many actors, starting with my colleagues at the Statistics Bureau, but also we count with the support of the Open Data Charter and the United Nations for Population Fund that with some funding allow us to engage with very prestigious academicians from other countries, not from Argentina. We have the chance to work with Maria de los Ángeles Durán, who is an expert from Spain, who has been studying the care economy for a while, and she guided us in the organization of the system. This was really important for us to be absolutely confident about the way that we were working towards producing data and organizing data that was later being used by many actors. And the same happened when we had the chance to partner with a colleague from Uruguay, Valentina Perrota, who is an expert from he's an expert on older population, and she also helped us to organize the data better, because being old, for example, doesn't mean that you need care. So with her advice, we restructured and organized the information better. It was the possibility to be working with them was also very important for us as civil servants, as staff working for the Bureau, because we had the possibility to access to an expertise that is not currently available in our regular learning institute. So this was empowering. This was a high incentive for us to continue working in this project. And also by being accompanied by international donors, by international cooperations, was an instrument that allowed us to engage in a dialogue with other stakeholders, not only from outside the government, but also with our own colleagues inside the government, who were more keen to collaborate with the data by sharing the data and offering this data for us to produce the indicators. I think that I am running out of time because I see Mercedes looking at me a little bit nervous, but I would like to finish by saying that we are currently continue working on this, like taking into account what Shaida mentioned before and how she stressed the importance of external actors to the government producing data. We are currently involved in a new ad hoc data creation project that has to do with a census that we are conducting at different private institutions providing care for older people in the city, and they are collaborating with us by allowing us to go into their institutions with a new survey that is, if we can move to the next one, I can show you a screenshot of how we are doing this. That is also innovative because it's not like a typical survey done paperwork, but it's an online form that we send to them, and they complete with information not only about the people receiving care, but also about the people providing the care. And this will allow us to complete our, to make our web portal more complete by showing information on the level of training of the people providing the care, by, of course, disaggregating the information by sex, so we will have like a gender analysis on that, and also by allowing us to calculate some proxies on the quality of care, because this is something that we are not currently measuring because it's very difficult to measure, but we are progressing on that regard. So I don't think that we have like the perfect story, but in a way we have been working along this path that Shaida mentioned, and willing to improve the work that we have been doing. And I will stop here.
Thank you. Thank you so much, Marisa. It's really very interesting practice and initiatives that Buenos Aires City is building the care indicator system. And I think that it's a milestone for other local governments seeking to use data to measure the distribution of care from socioeconomic perspective. So really congratulations. Now I would like to present the third speaker, the last but not least, that is testing the Buenos Aires care indicators and creating their own care indicators in Mexico City. Dulce Colin is the General Director of Equity and Attention to Gender Violence at the government of Mexico City. Before, she worked at the Digital Agency for Public Innovation, where she led a multidisciplinary team responsible for Mexico City's open government policies. She has over 10-year experience working on policy advocacy on gender equality, the right to the city, and civic participation. She has a bachelor's degree in journalism and master's degree in gender and public policy from the Latin American Faculty of Social Science in Argentina. So, Dulce, could you share with us how the work of the Secretary of Women in Mexico City is helping to bridge the gap, and what are the challenges on collecting and sharing public data about care in the public sector? Dulce, the floor is yours. Can you hear us, Dulce?
Yes, I had trouble in opening my mic and my camera, but yeah, I cannot open my camera. I don't know if the host can help me. Yes, yeah.
Here you
Hello,
are.
here I am. Thank you very much, Mercedes, and hello to my fellow companion in this awesome panel. It's 9:39 in Mexico City, but I'm glad to be here and yes, to share our experience in Mexico City in this amazing project that we are collaborating together. So, Mercedes, you sent me a question so I can elaborate from that. You asked me how is the work that we do at the Secretary of Women in Mexico City helping bridge the gap, and what are the challenges that we are facing collecting and sharing public data about care in the public sector. So I'm gonna start saying that I think it's not that bad in Mexico City because since 1983, Mexican government created the National Institute of Statistics, Geography, and Informatics, the INEGI. And actually, the president is currently there in person in the forum. So you should go to say hello to her, the people that are there. So this agency is, well, it's an autonomous public body and is the responsible for regulating and coordinating the national system of statistical and geographical information, as well as for collecting and disseminating information about Mexico in terms of territory, resources, population, and economy, which makes it possible to know the characteristics of our country and help in the decision-making process. I'm sorry. And so INEGI over the years have done an amazing work and extraordinary efforts to increase the production of gender statistics and sex disaggregated data. Actually, Mexico is a pioneer, or at least we are in Latin America, in creating national surveys that are strategic for the creation of policies on gender equality. For example, we have the National Survey on the Dynamics of Household Relationships, which offers information on the experiences of violence, maybe physical, economic, sexual, or some others that women have faced in different life environments, with their partners, within the family, in school, at work, or at the community. We also have the National Survey of Time Use, which provides statistical information for the measurement of all forms of work of individuals, both remunerated or paid and non-paid. That survey allowed us to make visible the importance of domestic production and its contribution to the economy, the way men and women use their time, as well as the perception of their well-being, all regarding the population age 12 years and over in urban, rural, and indigenous areas. INEGI even estimated that the economic value of women's unpaid work in Mexico represents 18% of the GDP. So that's national. At the local level, we, at the Secretariat in Mexico City, we have been leading efforts to make gender a mainstream consideration in the collection of administrative data records across the government organizations and agencies. Nonetheless, we are still facing some challenges regarding gender data in the context of the creation of the care indicator system, especially for the supply of care indicators, so we can know who provides and how do they provide care, even if it's the state, the households, the community, and the market. We have faced some difficulties accessing quality data at our own government organizations or that our own government organizations produce. For example, we have had to make special requests to know how many people with disabilities or elderly people are receiving the services we provide in the city, disaggregated by service, unit, and sex. Because it is not available in the city's open data portal, which leads me to the first intervention that Shaida mentioned in her presentation. So we have been facing that kind of difficulties, but the good part or the bright side is that we are not starting from scratch. This ongoing project that we have with Open Data Charter aims to test the indicators that were developed in Buenos Aires. In that way, we created a multilateral collaboration so we can determine which of the indicators are of broader relevance to cities around the world. So by testing these indicators, we think that we, as the collaboration, Open Data Charter, Mexico City, and I'm sure that Buenos Aires are thinking the same, allowed us to achieve three objectives around open data. So we can further our city efforts to release open data because we target which data sets are strategic to open, so anyone can do their own analysis. The second is to identify key data sets necessary for the care indicators system, and so we can advocate for their collection and publication. For example, I think that Buenos Aires faced the same that we are facing. It is very difficult to collect and to keep, I forgot the name in the word in English, I'm sorry, to keep publishing data sets regarding to the contribution that communities do to the care economy. And the third one is to keep promoting evidence-based policy interventions on gender equality, because we all know that one of the phases or the challenges of an equal female participation and opportunities in the labor force are related, very related to the care system. So we need to keep promoting these policy interventions so we bridge the gender gap in every aspect of our lives. So yeah, we can keep discussing these issues, but I'm gonna leave it here.
Thank you very much, Dulce, and I think it's really a good experience to share with the attendants, because it's an example what happened where different cities collaborate, sharing data and trying to create a standard to promote the comparison between the different level of advance in different local levels and also in national government. So thank you so much for your presentation. But I would like to leave the last 10 minutes of the session to a question of the participant. So I think I know that there are participants presentially in the room, and also we have participants virtually. So if anyone of them want to ask a question for a speaker or just only share your ideas, the floor is yours. Do you have any questions?
We have a question in the room.
Thank you.
We have a question in the room.
Thank you. First of all, I want to say thanks for Shada and her team for big work in opening data worldwide. Also for the Open Data Charter and Mercedes. They are helping us in fighting for corruption in our country and worldwide. So the question for Marisa, how is this project, which we are talking about, can improve the life of target group, and how it helps in decision making? Thank you.
Thank you. Okay. Yeah, let me unmute. Go ahead, Marisa.
Well, thank you so much for the question. Basically, let me tell you that we built this indicator portal with that aim, with the aim of improving people's lives. And basically what we are doing right now is promoting the use of this data within the government. And we have been very lucky enough to find like very good listeners and very interesting partners who are currently not only using the data for analysis, but also for decision making. And in that decision making process, they are asking us to reprocess some data, because the way that we organize it, that we organize the information was very rigorous, very accurate. We wanted every indicators to be able to cross with them among themselves, to show, to compare specific things. But sometimes this information that is that looks nicely from like a statistics point of view is not enough to make decisions. So just to go to the point, we are working with two ministries, with the Ministry of Health, in order to help them to understand how the population is getting older and how the needs of this elderly population are evolving geographically and also from a gender perspective. And with them, we are analyzing the needs for this population. So there has not been any decisions made at the moment, but we are working in that regard. And based on that discussion, we are also conducting this new census that I just mentioned. But we have been discussing mainly that, like the care for elderly people. And also, this information is also being used by some legislators, from some members of our local parliament, also to understand what regulations, new services for older people will be needed in the city. The law currently is kind of strict for some providers, and we may think of new pieces of legislation in order to promote more and better investment in that area.
Thanks, Marisa. We have one more question from the room here from my young Chinese colleague, Dolly. Dolly, you introduce yourself too.
Oh.
Can you stand up there?
Okay. Hello, I'm Dolly, and I'm Shada's assistant, and I help her translate. And I have a question for you. Is that as a as a college student, I'm not much familiar with this topic. So will you introduce for me that how will gender equality contribute to how will the open data on gender equality contributes to the society? It contribute to the society, to the economy. How can this data contribute to such areas? Can you answer it for me?
Mercedes or Marisa or Dulce, any of you who want to answer that is a general question of the link between care economy, this data, gender equality, and improvements in society. Who wants to take that?
Well, basically, I can start by saying that our data, equally to what data worldwide shows, is that there is an unequal distribution of care responsibilities. Women have, at least in the case of the city of Buenos Aires, work both paid and unpaid much more than men. But basically, the unpaid part is what makes the system very unequal, because this work is not recognized, is not compensated economically, and this constrains women for fulfilling their other rights, for enjoying a more autonomous life. So with this information, when we make this data available and when we make this work more visible, we are contributing to recognize that work and to show that this work should be redistributed and there should be a more equal distribution, not only within households, but as I mentioned before, also among the other actors, about public sector, the government, private sector, and also by the communities of any society.
Just to add, sorry,
go ahead.
Yeah,
one more question in the room. Your question, Dalia, is very important. So we all have to keep in mind. Please introduce yourself.
Okay, thank you. Hello, my name's Samantha Watson. I'm with the International Labour Organization. I'm actually leading work on the integration of time use measurement module into national labour force surveys, primarily in low and middle income countries. So this session very much spoke to me, and especially your point on the need for both the LFS and time use data. I just had a question on your indicator framework, which I think is just fascinating. So I think you mentioned there were 70 indicators, and that those are then being tested in different cities. I'd love to firstly just know if there's some way we can find out more about that, because I think that's a really important area of progress. And then, I'm sorry, I can't see you. And then sort of linked to that, I'm just wondering how holistic the indicator framework is. So I was quite struck by the map of Argentina, and I think the suggestion was that obviously you have pools in lower socioeconomic areas of the city where the paid carers are sort of being pulled from to provide care. But then, of course, many of those care workers are also having a very high burden of unpaid care work back in their households. So I'm just wondering, do you have those kind of total care work time burdens as an indicator, or is it a little bit more separated so that you're able to sort of, are you just saying, you know, for unpaid, say, domestic and care work, this is the inequality? For paid care work or direct volunteering, this is the inequality. Just very interested to see how all those 70 indicators link together. So talking to a screen here, it's a little bit weird, but I hope you can hear me.
Yes, I can hear you. And thank you.
I hope you heard that important question. Marisa, you want to answer that?
Yes, thank you very much for this very relevant question. The conceptual framework is comprehensive enough. We took it from the famous Rabatzi diamond of care, like where we identify the four actors providing care and how this is a system that it interrelates. The 70 indicators do not relate completely among them. They allow us to understand how care is organized, but it's not that we can measure the inequality gap in the paid care economy and in the unpaid care economy. This is where where, as I was mentioning before, when we want to make more specific decisions on when we want to understand more specifically how certain questions are answered, we need more data or to reprocess the data in a different way. Thanks thanks to the Statistics Bureau, who is the main actor working in the portal and with the ability to reprocess the data, we are in most of the cases able to answer or to get closer to these answers when we have the information. But just to be very specific to your answer, no, the 70 indicators do not completely relate among each other, but they allow us to understand and to answer specific questions about how care is organized in the city. On the paid economy, like how much money are care workers making and how is the gender wage gap, we do have some information, but not all, because this comes from labor and household surveys, and they not necessarily allow us to go in depth in all the care on the subsectors of the care economy.
And Marisa, the work that you have done and the research and the result is available online, correct?
Yes, of course. Everything is, unfortunately, it's only in Spanish, but we have the web portal is available. It's in open data. You can download everything. There is also a conceptual document that accompanies the web portal, where it is explained how we build the indicators, how we define the populations receiving the care, and also there is a short analysis. And here again, I would like to also stress again the collaboration that we have with other actors external to the government, because we included some short, very brief analysis on each of the situation for each of the populations receiving care by external authors, by UNICEF, by people from the university in the city, by people from, I don't remember now, but from different actors who also helped us to build the system.
Well, thank you. Mercedes, do you want to do the closing? I really appreciate everything.
Yes.
And Marisa, I think we have to find some grants for you to translate this work to English. All right, over to you, Mercedes.
Yes.
Yeah, I share by the chat the link of the system, but I'm not sure if you can see it. If not, we will share all the information of the panel by email. Yes, I would like to close the meeting with a closing remarks from the speakers. I would like to ask Marisa, Dulce, and Sheida, what are the challenges that you identify to use and to use this data to improve care public policies? Just in a few words, please, Dulce, if you can start.
Thank you, Mercedes. I just wanted to try to elaborate in the question that Sheida's assistant did before. She asked what is the relation between the care system or the care indicator system and the economy. And I don't want to miss the opportunity to say that it's a very interesting question that many feminists in the economics and many other disciplines have been answering. And I think that in my intervention, I said that in Mexico, we estimated INEGI estimated that the economic value of women's unpaid work represents 18% of gross economic product. So that is huge. That not very few sectors contribute that much to the economy as we, as women, do with the unpaid work that we do in our households. So women are subsidizing the economy because our societies are organized around the production and the reproduction of life, that is taking care of your family and or taking care of your community has been marginalized. So the work that we are doing, that Buenos Aires did with their indicator system, the work that Bogotá is doing with their public care system, it's contributing a lot for the economy, because women are now allowed to enter to the formal economy, so we can gain more rights, and we can bridge the gap that are still there in many aspects of our societies between men and women. And yeah, that's why we are doing this work, because we want to inform the policies that we are doing in Mexico City with the correct data, because we are determined to bridge those gaps. So that's it. Thank you very much.
Thank you.
For listening.
Mercedes, we are over time, and some of us have to
We
run
are-
to the other session. So can you do the closing yourself, please?
Yeah, of course. Well, thank you very much for the participants virtually and in person that participate in this amazing session. We will share with you all the materials that the ladies share with us. I think that we advance a lot sharing and publishing gender data, but we have a lot of challenges for the future. I would like to just mention three. One is the importance of cross-sectoral collaboration and invite private sector and communitarian organization of the conversation. And of course, we have a lot of challenge for expansion and try to make a standardization of the data to comparison the different advance of the cities in the world. And also the last point that I would like to mention is the care sector is highly varied and complex. So we need all the key actors that provide and receive care in the public debate. So thank you very much, Sheida, Marisa, and Dulce, for taking time to share your presentation and your work. And thank you, UN World Data Forum, for inviting us to coordinate this amazing panel. Have a great day for us, have a great night, and see you all and enjoy the UN World Data Forum program.
Thank you, and thank you. And this session is going to be, of course, recorded, and it would be broadcasted later. So anyone who's missed it because of time zone or other parallel sessions, I hope they would get to watch it. Thank you so much again to Open Data Charter for organizing this session. Bye.
Bye. Good day.